Europe and Central Asia, there is a prevalence of undernutrition, overweight, obesity, and high prevalence of micronutrient deficiencies, like a triple burden malnutrition present. Therefore, food system approach have a great opportunity to improve nutrition and quality of the diet and prevent all forms of malnutrition. According to the global panel of experts, the definition of the food system have the three main core elements: food supply chain, food environment, consumer behavior, and the link between food system and diet and health outcomes and nutrition are the main elements for connection between food system and health outcomes. In 2014, there was International Conference on Nutrition, and all governments committed and agreed on the Rome Declaration for Nutrition and the framework for action with 60 policy recommendations. In 2015, there was another action related to the 2030 Agenda for Sustainable Development Goals. And in 2016, Nutrition Decade was one of the main action related to the smart actions and commitments for policy recommendations in all countries. On regional level for Europe and Central Asia, in December 2017, that was a regional symposium for sustainable food system for healthy diets, and the key messages for this region were adopted in order to follow all these activities and promote a sustainable food system for healthy diets. We are organizing this symposium in Belgrade. The key messages and the Belgrade Declaration for Sustainable Food System for Healthy Diets for this region will be made to support countries for the implementation of these policy recommendations and key messages and ICN2 framework for action and nutrition declaration. FAO and WHO prepared the resource guide for the countries for the implementation for the strengthening nutrition. And further action and follow-up activities will be necessary for the capacity development in this region and in international level as well for support countries for implement these recommendations.
The symposium, which is dedicated in order to have more sustainable food systems also in southeastern and central European region. Important in that context is to mention that we need in the coming years an increase of sustainable food systems and healthy diets. A sustainable food system means we have to take into consideration economic, social and environmental factors. We have to increase education related to nutrition. We have to take from the government point of view further action, and we have particularly also to address the civil society. One of the key points from FAO's perspective is certainly to address also not only rural areas, but we have to address also urban areas. We will have further increase of the population living in urban areas, and nutritional issues and food insecurity in urban areas is also an area which is quite important. So what we would like to do with the symposium also today is to raise further awareness for the issue of sustainable food systems. We would also certainly like to increase the networking to bring the civil society, the private sector, the research and the government further together in order to address these challenges for the near future.
pattern of malnutrition and food insecurity in this region, Central Eastern Europe and Central Asia, is very diverse. So we are witnessing still an unfinished agenda in the terms of the chronic malnutrition and stunting in certain countries and regions in Central Asia and Caucasus, while on the other side, our region is facing the highest rates of increase in terms of the obesity among children. And that's 100% increase from 2000 to 2017. From the other side, we are still having macronutrient deficiencies among most vulnerable groups, children and the mothers and the pregnant women. And that's basically due to the absence of larger-scale food fortification and other healthy practices for having a diverse diet in the region, which poses risks to the outcome of the pregnancy. Unfortunately, the region is also among the regions with the poor performance of infant and young child feeding practices. Specifically when it comes to exclusive breastfeeding, we are having the lowest rates of exclusive breastfeeding globally in this region. And all of this together, they're contributing to this mixed picture in terms of malnutrition in the region. There are several delivery systems for having better nutrition results. One of them is food systems, but also there are other systems like education system, primary healthcare system, social protection system, and even the legislative systems. So when we look into each of these separate delivery systems, we witness that there are gaps. And these gaps are the clues for us that what could be done better to address the mixed picture that I just explained before. In this region, unfortunately, we are facing huge difficulties around having a strong and well-enforced legislation that are regulating the protection of the lactating women rights and the promotion of the breastfeeding and limitation of the breast milk substitutes.
Well, public health is very important for our society, and it is determined by the diet, what we have every day on our plate, what we choose from the shops, what we prepare, etc. But the food supply and public health are intimately related via the plate, via what we eat every day. When we look from our diet back into the food chain, we have to do with food industry, with retail, with food production, with environmental sustainability. And the coming decades, this will become a problem because we are meeting the planetary boundaries at this moment, and the population is still growing. We are an aging population. We become older and older, and we are confronted with age-related disease, with non-communicable diseases. We are confronted with obesity, with diabetes and cardiovascular diseases. This is also mediated by the diet, and we need to understand why consumers choose certain diets, how this affects their health. Do they choose it because of convenience, price? Do they choose it because it's available in the environment? What is the role of affordability and the access? And on the other side, when you eat it, it's not just nutrition as such, it's also a social thing to have your dinner or have your meals with other people. In this conference, we want to build that bridge, think about that bridge, and try to develop steps and identify steps that we can make to fill in the gaps in between the food supply and public health with the consumer in the center.
The main role of EFSA is risk assessment. Risk assessment can be done only when data are available, so EFSA is really into collecting and analyzing data in order to provide the base to risk managers to come up with legislation and policies that will protect EU countries' population. So what we do at EFSA is collecting harmonized food consumption data under the EU menu project, which I'm managing, and in order to provide more accurate dietary exposure assessments. So we do support EU countries to follow this methodology to collect standardized, up-to-date food consumption data, which will give the floor then for more accurate dietary exposure and more accurate nutrient intake calculations.
trans fat is an artificial fat that is produced in a chemical reactor, and it has been the foundation of margarine, and it appears in a lot of food products, and it has been used in bakery, in deep frying of food. But for about 30 years ago, it was discovered that it increases the rate of heart disease because it increases the bad cholesterol in blood and it decreases the good cholesterol. And the situation was rather convincing. So in Denmark in 2004, we were the first country to make a legislation. We introduced a trans fat ban in 2004. And then a number of countries have introduced the same ban, Switzerland, Austria, and other countries. And I have been rather interested in the situation in the ex-Yugoslavian countries. So already in 2012, I went down and I investigated biscuit cakes and wafers. And in 2012, I found a lot of foods in each of the 6 countries of the former Yugoslavia. And then I did the same exercise in 2014 and was very surprised to find that it has nearly doubled. The amount of biscuit cakes, wafers with trans fat has nearly doubled compared with 2012. But this year I found 38 foods. So there has been a tremendous decline, but still there is food out in your supermarkets that contains high amount of trans fat. And now it has been considered so dangerous that EU has introduced a legislation, United States has introduced a legislation. So, and WHO want to remove it from the global food supply. So if you want to avoid trans fatty acid in your food, you just read on the label. If it says partially hydrogenated fat, then leave it, then the producers will stop producing it. But you have done a marvelous progress in removing it, but still it's possible for some people to get too much if they buy the wrong food in the supermarkets.
The ministries, both Ministry of Agriculture and Ministry of Health, which are in charge for the safety of food of animal, non-animal origin and for food security, are giving their best to prepare some legal basis for the implementation of all necessary steps. We are aware and we really support all initiatives done by scientific society to improve nutritional value chain, to improve our dietary habits, to decrease the obesity and to increase the most capable and most valuable food for our consumers. All these matters are very important, and we hope that in this area we will increase the knowledge and skills to all stakeholders, so primary producers, food or business operators and consumers, that we have a maintained data collection system, and that we will have one build capacity in the area in food safety and food security.
Sustainable food systems and methodology of sustainable production in Macedonia. What's interesting is that the government is showing an interest in implementing some of the programs for sustainable production, and that's the next step, which was announced in a government program, that they will focus on initiating special program for sustainable production and for sustainable agriculture.